Daily deaths across the UK are now at their highest since June, with more COVID-related hospitalisations in England than there were when we went into lockdown in March.
Well, scientists as well as the Labour leader have called for a circuit breaker lockdown in England to get the virus under control. But would it work? Well, we're joined now by Chair of Global Public Health, Edinburgh University, Professor Devi Sridhar, Professor of Oncology, Angus Dalgleish, and epidemiologist and member of independent SAGE, Dr. Gabriel Scally. Let's talk to you first of all, Gabriel Scally, because SAGE have been very clear in the minutes that we've now seen that they believe a circuit breaker lockdown nationally is what is now required. Can you explain why that is the case?
Professor Scally.
Professor Scally, can you hear us?
Yes, I can.
Sorry.
The SAGE minutes are really interesting, and even more interesting is the document that they considered at that meeting on the 21st. And they did suggest a real strict range of measures to be put in place to really stop the exponential growth that's happening. But they also said in that document they considered that the test and trace, the NHS test and trace system was really not working. It said it was having a marginal impact on transmission at the moment, and that it was likely that the impact of the test and trace was going to further decline in the future. So it is quite a crisis. So I think that's where the SAGE experts are coming from, and it's very odd and very unusual for a government that says that they follow the science not to have followed the science on this particular occasion.
And that's the point that Rachel Reeves was making for the Labour Party, Professor Sridhar, because they were saying that if you did this 2 to 3 week circuit breaker, which now Sir Keir Starmer is backing, you would use that time, as you've consistently suggested, to get that test and trace system back on the rails. Is it enough time? I mean, we have a private company running the system at a cost of billions. Labour say hand it over to local public health authorities. They already have extensive experience in running this. But is it as easy as that?
Well, that is definitely the first step of this. And if we look across the world, other places are managing to test thousands, tens of thousands, millions in the case of China, people within just a few days. And so the question is, why aren't we seeing that same political will and leadership here to actually really get on top of this? We will be stuck in this spiral of lockdown and release cycles. It has been modeled out for the next year and a half until we can break that chain through actually having a testing and tracing system to come into place.
But my question is, if the government suddenly changed tack and said, you know what, we've reconsidered those minutes, we think a circuit breaker is now necessary, you have to use that time to do something effective, otherwise the virus simply comes back in 2 or 3 weeks. We know that because that's exactly what happened after the first lockdown. And we've already got lockdown fatigue. We need to know it's going to work. Can we shift the test and trace system to an effective system within that time frame?
Well, we must. We have no other choice. We have to get out of this cycle. And the message I would say to people is to keep hope. I think a lot of people now are feeling fatigued. They're feeling angry. They don't want to follow the government guidance because they feel like, what's the point? And the thing I would say is it does make a point right now. You're doing this for your family, for your friends, for your communities. No one should be exposed to this virus right now. And we take these 2 weeks because if we do that 2 weeks, we can start getting on top of this. The longer we delay, this is the mistake we made in March, the longer we will be stuck in some kind of lockdown because it'll take longer to go up and longer to come down. Where the countries that entered and exited their lockdowns quickly did so while we were still stuck in this over the summer.
All right. Professor Dalgleish, you're Professor of Oncology. I happen to know you're a brilliant Professor of Oncology. You are a founding signatory to this Barrington Declaration. You do not think that the lockdown strategy is the right one. Why?
Well, first of all, the first lockdown hasn't worked, and you've got the second wave coming back, which is totally predictable. If you lock down people away from their normal life, and especially those who are locked up in small flats, and they get low in vitamin D, they don't do their exercise, and you then let them out, they're going to be sitting ducks, as it were. And I think you're going to get cycle after cycle of this. This is a disease which doesn't kill young people in the way that the deaths come across as doing. I think that the young people can spread this disease. I know very few people now who haven't had this disease in one way or the other, and their physical symptoms have raised from they didn't know they had it, and they had it on testing, all the way through to being really, really ill. And I think that we cannot keep the country locked down just for the sake of preventing a few deaths. As an oncologist, we are building up tens and tens of thousands of unnecessary deaths because we've not addressed this problem with the COVID infection, and realizing what we can do and what we cannot do. And let us look at, people keep saying that you've got to have a lockdown, you've got to have a lockdown. Just look at Sweden. They've managed, all right, they had a high death rate initially, but they made the same mistake as we did by actually putting people from hospitals into care homes, and they had a big problem there. But otherwise, they are actually coping with this much better than we are, because they told the people that, you know, don't go into places and get infected. The young people are going to. You cannot change the behaviour of young people.
No, but I think there is, if I may jump in there, I think that Sweden is an interesting case, but certainly they've got a far higher death toll than any of their neighbouring countries. We know that. 10 times what we've seen in somewhere like Denmark, for example. So I'm not sure that they're the great sort of utopia that people think. But in relation to the effectiveness of lockdowns, is it not true that back in March, April, we knew very little about the virus, and we saw what was happening in Italy, second best health system in the world, getting completely run over? Surely a lockdown, what it does, it buys you time. And as Susanna said to Professor Sridhar, the real question is, do we have a testing system which can allow us to lead the normal life that we would all like to lead? Nobody wants a lockdown. But is it not true that one of the problems we have, Professor Dalglish, is that the government's testing system they put in place is simply not up to scratch?
Well, that would appear to be the case, and I'm rather surprised that that's the case when so many others have it working very effectively. But my point is that I think that just having lockdown after lockdown, all you're going to do is destroy people's lives and destroy the economy and destroy the morale. And that's how I got involved into the Barrington debate, is because two colleagues of mine have committed suicide over the effects of the lockdown. If you know somebody with something, it's common. If you know two people in a couple of weeks, it's very common. It's possibly the tip of the iceberg. And I think that I'm aware of all the cancer, I work in a big teaching hospital, aware of all the impact on cardiac conditions and strokes, etc., not being treated. For the knock-on impact of this is going to be way excess, I believe, of COVID deaths.
OK, well, let's bring in...
You know, we're talking about...
We're just losing your line slightly. But Dr. Scally, I just want to pick up on those points. Professor Dalglish makes, lockdown can have a devastating effect in all sorts of different ways. We know that, anticipated and unanticipated. Lot of people point to Sweden and say, look, they are doing the social distancing, they're doing the hygiene, they're doing other measures and getting on with their lives. Piers points out, actually, it means that in those Scandinavian countries, Sweden has fared worse than its neighbours. But Sweden has fared better than us when it comes to the economic effects and the rate of deaths as well. Is Sweden doing something that we could in some way mirror?
Well, there are loads of countries that have done better than the UK in terms of deaths and economy, because the UK has done so really badly. And the last lockdown did work. It did suppress the virus. It was introduced too late, and some of the measures, should have been taken weeks before it did. But the government's looking like a one-trick pony at the moment, because, and the WHO has said in the last few days that lockdown should not be the first measure that people turn to. In fact, for our government, it's about the only measure. And what we really need to do is get this find, test, trace, isolate, and support system working. And there's no time for messing around anymore. So if I was sitting in Downing Street, if I was Boris Johnson, I'd bring in Simon Stevens, head of the NHS, and say, look, this hasn't worked for us. The NHS is going to take this over. I want you to set up a regional and a local structure working with local authorities, directors of public health, and I'm going to give you 2 or 3 weeks to get it up and running, Simon. That is your job from here on in.
Yeah.
The NHS is the only organisation that I know of that could actually do this properly and do it quickly.
And a lot of people have said that from the start and just bemused we've shoveled it out to these private companies, which
at a cost of
have proven
billions.
to be totally incompetent. Professor Sridhar, finally, we're all praying and hoping for one of two things: a vaccine or drugs that stop people dying. We're obviously making some progress with drugs, which is great. But the vaccine chat appears to be going a little bit quieter. And in fact, there was an expert at Oxford overnight saying it may not be until July at the earliest that we get an effective vaccine up and running. Well, that is, 9 months away.
And then only for key groups such as frontline health workers, who, of course, we'd want to prioritise. But that's not a universal vaccine for everyone, is it?
No, I mean, I think waiting for a vaccine as your short-term strategy or medium-term strategy is not optimal, because we will be caught in these cycles of lockdown and release, which are destructive. And this is where I think you do see consensus among the scientific community. Nobody wants to lock down. It's a last resort measure. The problem is, what are your alternatives? So one alternative is to build up a test, trace, isolate system and to keep that running for the next year and to try to get back normality. Look at East Asia. Many of those countries are back to normal. Pacific, I mean, Australia is almost there. You'll have New Zealand, Australia back to normal life. That's where we should be looking. Sweden's actually still living under restrictions. They're asking people to work from home, to avoid public transport. They are looking at local lockdowns, and they did shut upper secondaries and universities. So I think we have to be also careful with our comparisons. Sweden did not lift all restrictions and just have the virus rip through. The idea of kind of shielding the vulnerable, I know it's attracted attention and it is theoretically attractive, but you look at the numbers involved, it would be 25% of people, plus their families and close contacts. So if that came to about 30 to 35% of the population, it's basically harsher than the lockdown we have now, and the mental health of those people who would be expected to shield indefinitely would be even worse.
OK, so Professor Dalgleish, final question for you. Why is it that so many eminent scientists don't agree with each other? Because it would be a lot more, I think, a lot more constructive for the public if it looked like there was a united view of all this. But it looks like now, increasingly, you've got the anti-lockdown science and you've got the pro-lockdown, and the public are wondering which scientists to believe.
Well, it's always been the case. That's the whole point of science, is to have a debate. So you go with one theory, you prove or disprove it, and then you go for other explanations. And it's always been the case in science. And the thing that comes through is that what actually often makes a difference is completely off field, as it were, from what the majority were looking to push through. And I think that we've really got to address this very strongly for all the reasons I've said, not least the incredible damage that's being done to the economy. And the economy means jobs, and the jobs means the livelihoods of our children and the next generation, which has been completely trashed. And I know that because every day I hear of people who've lost their jobs who never believed they were going to. And with regards to this virus, as a physician, I have treated, over my time as a general physician, young people with flu, pneumonia, who've come in and who've died. Nobody shut down the economy for this. We've had waves of it. We had a big flu epidemic in 2017, 15, 28,000 people died. We're talking about 42, 43,000 people now, in order to address it, destroying the economy, destroying the livelihood and everything of the generation below. And I don't think it's necessary.
Okay.
Well, it's interesting hearing that from such an eminent scientist and physician. Thank you so much. And sorry for your loss as well, Professor Dalgleish.
Yeah.
Because to lose friends.
A lot of people are really
desperate.
suffering out there, and it's not going to get better. It's going to get worse before it gets better. And we need to understand that.